Good afternoon. Mark Johnson, spokesperson for the Beetle County COVID-19 Unified Task Force. Before moving into our discussion topics, I would like to make an announcement. Over the past months, you have been spending your Friday afternoons with the Beetle County COVID-19 Task Force, and we thank you for tuning in. The task force is going to continue to work with our elected leaders and continue mitigation efforts so we don't see a spike in COVID-19 cases. We will continue to provide the normal Friday updates at 1 p.m. However, they're going to be more of a brief of what has happened over the last week, and they will be delivered over Facebook Live on the Beetle County COVID-19 Facebook page. COVID-19 is still just as present as before, and things can change very quickly, where we would start doing the formal community updates once again. The current updates from the South Dakota Department of Health shows 21 positive COVID-19 cases in Beetle County and 3,144 cases statewide. Of the cases in Beetle County, 19 of those individuals have recovered, and there are only 1,044 active cases in the state of South Dakota. Beetle County now has no community spread, according to the information from the Department of Health today. This is due to the great work by our community members with their mitigation efforts and the numerous days of no positive cases. As we move forward, the Beetle County Commission and City of Huron Commission are currently working on repealing ordinances and adding guidelines with resolutions to allow businesses to reopen and welcome customers back into their businesses. The City of Huron Commission is meeting tomorrow and should have items finalized with guidelines for those businesses. The Beetle County COVID-19 Task Force would like you to think about a few things that have happened over the past couple of months, along with look at other places around the state. The task force encourages you to weigh all the odds and risks with all the possible outcomes of the decisions that you decide to make. As Huron Mayor Paul Elward stated earlier this week, we have a killer amongst us, and it's currently in hiding. COVID-19 has not went away. It has only been slowed down to the mitigation efforts everyone has done. And we thank the public and every single one of you for the work that you have done. I'd like to recap where we have been. Hopefully this will act as a reminder to all of us so we make wise decisions in the upcoming months. Beetle County started with a spike and was increasing faster than larger communities in the state of South Dakota. Of the 21 cases in Beetle County, 3 of them were hospitalized. Keep in mind, those 21 cases were individuals that were confirmed by the South Dakota Department of Health because they fell into the category to be tested. The state of South Dakota still could not test every single citizen due to testing supplies. 2 of our citizens paid the ultimate sacrifice, one of those being an educator to our children and the other being our state legislature. Governor Noem specifically called on Beetle County officials to act. This very easily could happen again. It is going to be the responsibility of our citizens to prevent this from happening again. You will have the responsibility of weighing those odds and what risks you are willing to take. Some things to consider when assessing the risk and possibility of further spread in Beetle County, we can look at other locations for possible scenarios that could create possible headlines. Beetle County has large employers. We have meat processing facilities. We have senior living centers. We have vulnerable populations, and we have congregating points in our communities. Those scenarios could be Beetle County very easily. There's a high level of personal accountability and personal risk tolerance that each member of our community needs to self-assess. This will be a personal decision and personal responsibility to decide what is the best for your family, whether you decide to go someplace. If the respected commissions provide guidance after changing ordinances, it is every single individual or business that will have to make a decision. Just because a business is allowed to be open doesn't mean they have to change their current business practices. They could decide to continue with their current operations as is. The responsibility still lies on that business to decide to open, how they are going to keep their employees and customers safe. With all the guidelines out there, and if they can offer everything as they did 2 months ago, the responsibility of deciding to enter an establishment is each individual citizen's right and risk that you will have to assess. If one business is being more responsible than another, that is your right as a citizen to decide where you choose to go. With the threat of COVID-19 still present, the task force does get asked, why even open things up? This has been examined and comes down to economic sustainability while mitigating those risk factors. While the sole responsibility is on each and every citizen on how they are going to handle the situation. Along with these are uncharted territories. The task force isn't able to open up to page number 145 in the FEMA handbook to tell us what to do. There are risks involved in our daily lives. Our elected leaders will continue to evaluate the risk, and if things start to go in a bad direction, they do have the power to enact another emergency ordinance. It is solely riding on each individual's personal responsibility to keep themselves safe. Even when these changes go into effect, the Beadle County COVID-19 Task Force will continue to encourage minimizing trips outside the home, reducing non-essential travel, and maintaining our social distance. If we are able to maintain these efforts, there won't be an increased infection rate. It will be the responsibility of each individual to decide how you will treat everyday activities. The Beadle County COVID-19 Task Force will be here until the end. We will continue to stress those social distancing guidelines. The task force is prepared to be in place as long as it takes, and will continue to monitor the current trends and provide guidance to our elected leaders. Until there's a cure or vaccine, COVID-19 is still lurking and still just as dangerous. We're going to take a look at some of the updates from other branches of the task force. First off, with rental assistance, individuals who have experienced unemployment problems due to COVID-19 are still encouraged to apply for rental assistance by www.helpcenter.org/Beadle. The employers are encouraged to complete their verification email for assistance, as that assistance won't be processed until that information is returned. The rental assistance has received an additional $5,000, and it's been added from the Wings Foundation. If anyone does need anything, you can contact 211 for information and resources. As of today, 20 individuals have received rental assistance, and assistance has been distributed in the amount of $12,651.50. The call center and testing facility, both facilities are still active. If you have questions relating to COVID-19, you are still encouraged to contact the call center at 605-353-6214. And with that, we're going to speak with Julie Miller from the South Dakota Department of Health. She has some information if our city and county decides to open up, and some responsibilities that go along with it. Julie?
Okay, thank you, Mark. My name is Julie Miller, and I'm with the Department of Health. And I would like to re-emphasize everything that Mark has just said. It is so vitally important that we continue with our personal responsibility and social distancing, and it is not back to the normal that we knew. We need to think of a new normal and try to figure out the safest way to do things going forward. One thing that I would really like to emphasize as the city looks forward to opening up again, the Department of Health does have a business support team to support you, and maybe you're working with them already, but I don't know if all businesses are aware of that. It would be great to have that support and guidance as you move forward, because I'm sure there's going to be lots of controversy. People have lots of opinions, and I think if you call the 800 number at the state, that 800-997-2880, you would be able to get the website to contact a business support team. Some other things that are updated on the DOH .covid website would be, there's a lot of new checklists, business checklists. So as you're going back to whether it's manufacturing or retail or whatever type of business, there is a checklist for you to go through and see how you can meet that standard to help you do things most safely for your employees and your customers. The one thing that I would just really like to stress is the importance of being kind. And I know that we've seen a lot of the ways across the nation that people have responded to restrictions or to not being in favor of how a business opens or whatever, and some of the ways that people react. And I think in South Dakota, we probably all are shocked to see the way some people react. So I just really want to remind us all to be kind and think about how we're reacting to everything that's happening, and to be kind to others' opinions. If a business is open and you want to go there, you know, and support them, that's great. If you don't want to go there, that's perfectly fine as well. If a business wants to open, that's their choice. If a business is choosing not to open, that's also their choice. So if a business doesn't feel they can do it safely, you know, more power to them, because it's their priority is protecting their employees and customers and wanting to be as safe as they can for everyone. So I guess those are the main points that I wanted to stress today, Mark.
Okay, thank you. All right, what we're gonna do next is we're gonna go over the, I'll say, highlights that the Beetle County COVID-19 Task Force has given to our elected leaders in a back to business plan. My disclaimer for this is to give everybody in the public an idea of what could be in store, but this information is subject to change at the city and county level, is because they still have to go through their meetings. Our elected leaders could decide to take certain portions out and do different things. So this is just kind of an informational item for the individuals that are watching. So just be prepared that some things could change. The City Commission has their meeting tomorrow morning at 9 a.m. and we'll be going over more of this. So this is the Back to Business plan. So going through this plan, we kind of go over where we have been and kind of recapping some of the items that we've already talked about with the emergency ordinance. Since the ordinance was put into place and social distancing was implemented, the number of cases in Beetle County has dropped to 0 for the last consecutive weeks. While it is important for the community to continue practicing social distancing, the COVID-19 task force and local leaders or officials are recommending that the restrictions in the ordinance be modified. Where are we going, or kind of where are we trying to steer what's going to happen next? There will still be restrictions that are going to be placed on businesses in order to continue to combat the spread of COVID-19. The recommendations are based on updated data modeling and input from the medical community. There's information that's coming in on a daily basis with the data modeling where they're tracking the cell phones. So things could change as we proceed through this process, or modifying some of the restrictions in the ordinances right now. And as it says, those restrictions are fluid and to continue to address the problem at hand. The goals: to keep the most vulnerable people in our community safe, mitigate the risks for businesses, customers, and staff, and balance the threat of the virus with the threat created by a faltering economy. So the strategies of this plan: it's tactical, it is data driven, it is not something that the task force came up with in a matter of a couple days. They're looking at all the information that they have from that cell phone data all the way through to what our medical facilities can handle. It is simple, so it's easy to understand for the employees, for the employers, and also customers that are going in there. It's credible. The planning section of the task force has looked at the guidance from the CDC along with the OSHA guidelines and also the medical input that's out there, and responsive, where they are able to adjust the restrictions based on what is going on or what is trending currently. The situation today, conditions have changed dramatically compared to where we were on March 23rd when the emergency ordinances were enacted. Primary considerations for modifying these restrictions are the downward trajectory of influenza-like illnesses reported over the last 14 days, the numbers or documented case within a 14-day period following sustained community spread, so those numbers are at 0 right now. No clusters of cases that pose a risk to the public currently. Plan is in place so all persons with COVID-19 symptoms can receive a test upon recommendation from their medical facility, which is the case through the Department of Health, through their medical provider, and the testing facility that is available, and bending the infection curve in South Dakota well below the capacity of the hospitals. More accurate predictive modeling of virus spread and hospitalizations. Back on March 23rd and the days before that, there wasn't a whole lot of modeling that was going on. Now there's a lot of information that's actually being tracked all the way from the local level up to the federal level. We're able to measure the effectiveness of the mitigation tactics. Evidence of community willingness to embrace those social distancing has been the biggest success factor when looking at this plan. And the residents are highly encouraged to continue to practice really good social distancing. So some of the outcomes: ensure uniform social distancing implementation throughout the community, helps reduce risk from restricted businesses reopening, it protects access to life-saving hospital resources, increase food security among the low-income population, reduces demand for food assistance that doubled in 30 days, and where possible, those out of work will return to work to become self-sufficient again. So a summary of this plan: the proposed resolution would take effect immediately upon passage. If passed, all previously restricted closed businesses are allowed to reopen. It is still recommended that persons in high-risk groups stay home when possible and still take extra precautions. Everyone is highly encouraged to continue to follow the CDC guidelines and recommended hygiene practices, including engaging in those social distancing, wearing masks when you're outside. The restrictions will remain in effect until July 1st, unless repealed, modified, or extended. All businesses within Huron will observe a list of guidelines to slow the spread of COVID-19. Some of those highlights include establish clearly marked one-way shopping aisles in customer traffic areas, plexiglass dividers where physically possible between staff members and customers, continue to encourage customers to use curbside pickup or drive-through window with electronic payments, hand sanitizer locations readily available for public and staff, provide training to employees on COVID-19 awareness, personal responsibility and social distancing, limited access or closure of employee break rooms, conducting daily staff temperature checks and illness screening is encouraged. Hair salons, nail salons, and barbershop staff will wear masks and clean and disinfect between every client. Gym and fitness facilities must clean and disinfect equipment between each use. Seating in theaters will be reduced to allow for social distancing with certain seats blocked off to ensure customer self-compliance. Occupancy restrictions. Restaurants, bars, and casinos are limited to 10 customers, or 1 for every 100 square feet of customer seating area, or 50% of occupancy rating, whichever is greater. Other businesses are limited to 10 customers, or 1 for every 200 square feet of customer service area, whichever is greater. Some of the concerns with the infection risk by the activity that maybe a staff member has or has contact with the public. Lower risk would be individuals in this category. They have minimal contact with the public and other coworkers. Moderate risk would be when individuals are in close proximity within that 6 feet of each other. It is only for short amounts of time in small groups, and there's little or no sharing of common areas or surfaces. Substantial risk would be individuals in this category tend to be in a significant groups in close proximity of each other, less than 6 feet for significant periods of time, and or activity sharing of common areas and surfaces. So some of the questions that this plan does go over, for example, when can churches and other places of worship resume religious services? Answer to that, churches were never required to close as they resume services. They are encouraged to consider the guidelines for public gatherings and to implement steps to maintain a 6-foot minimum social distancing. When can daycare centers reopen? Daycares were never explicitly required to close. They can reopen at any time and are encouraged to emphasize enhanced sanitation. Do you have to wear a mask when you're out in public? Masks have never been required, but residents are strongly encouraged to wear them in accordance with the CDC guidelines. Does this mean that I no longer have to stay at home? The answer to that is Huron and Beadle County never issued a stay-at-home or a shelter-in-place order. Residents are encouraged to use common sense and practice good hygiene and reasonable physical distancing. Persons having one or more of the high-risk factors should strongly consider staying at home except for essential trips. That would be your groceries, medications. Are outdoor venues and events allowed to open? Outdoor venues and events are allowed provided they follow social distancing and other city, county, state, and CDC guidelines. Is travel allowed to and from Beadle County? Here in Beadle County, never prohibited travel within the state or to and from other states. Residents and visitors are encouraged to use common sense and stay at home if they are sick or have been exposed to the virus. Question, can doctors, dentists, optometrists, chiropractors, and other healthcare providers resume operations? Non-healthcare or non-hospital healthcare, including clinic visits, can resume so long as providers maintain that social distancing of clients, use enhanced sanitation methods, secure adequate supplies of personal protective equipment, and make sure of that equipment to protect clients and staff during visits. Are modifications permanent until virus threat is over? Answer to that is not necessarily. Adjustments to the restrictions may be made when they are changing trends in public health data. Will businesses be back to normal when they reopen? Answer to that, likely not right away. In other communities that have reopened, there's been mixed response from residents. Some people are ready to resume patronizing their favorite businesses. Others may be hesitant to make shopping trips that aren't essential in the short term. People having risk factors are still being encouraged to minimize their exposure. We still have the threat of the coronavirus. It has not gone away just because the city and county are looking at reopening. It's still a threat and active around the state of South Dakota. A simple reminder, reopening does not mean the virus is gone. It means we think we have the room for you at the hospital if you were to become infected with COVID-19. Once again, this was the back to business plan that has been provided to the city and county officials. That is subject to change. They have to vote on the items that are in that plan. It is not as simple as this is the plan that you see on the screen today, because it could change tomorrow. Let's see if we have questions here. And I don't see any questions. So, as I made the announcement earlier, the plan is we will just do regular updates It'll be real brief over Facebook Live. Thank you for everybody participating. The task force is still gonna be very active. And with the presentation, the back to business presentation, that is just a presentation. The city and county elected leaders still have to vote on it and they could make changes. So that's kind of a guide to where things are at right now within the city and county. So I thank everybody for tuning in, and that's our,
We have a YouTube comment asking about the parks.
okay, we do have one question in regards to the parks. I do know that the Park and Rec Board has met earlier last week, and their recommendations have been made to the, I believe the city commission's gonna deal with them on Monday night. So you'll have an answer with the parks on Monday. Okay. I thank everybody for tuning in, and as I said, next week will just be it'll be a Facebook Live, real brief, this is what's been going on. Thank you.